A new option before traditional spine surgery? What if patients had another option before major spine surgery? Many patients with lumbar stenosis fall into a difficult gap. Conservative treatments stop working, but major surgery feels like too much. For some physicians, that gap may be starting to close.
Hi, I'm Dr. Xiao from Chicago. I think that what the KIC have come up with here is a great way for interventional pain physician to perform microdiscectomy, femorectomy, and posterior hemilaminectomy decompression for patients with mild to even severe lumbar stenosis. I look forward to apply this technology in my practice.
The future of spine care may not be choosing between injections and surgery. It may be creating more options in between. As new technologies emerge, when should physicians begin evaluating them?